A big part of what the Zambian National AIDS Council does is try to ensure that all citizens, regardless of where they live within Zambia, have access to HIV/AIDS services. To do this, we need to ask 3 questions. Who is working with HIV/AIDS in Zambia? What are they doing, and where are they doing it? To answer those questions, in Southern Province, we've developed an online stakeholder management tool, and that's what I'm going to show you today. So this is the front page of the system. Need to arrange meetings, or if we want other organisations to start contacting each other. We collect the target groups because we're trying to make sure that all of these groups have been covered by these services in some way or another. We've answered the who is working within Livingston District. What we'd also like to know is what they're doing and where they're doing it. And so what we're doing in this system is we're collecting that information. And you can see we're saying that NZP Plus do condom distribution activities, which is a prevention activity. And they're doing it within the Dumbwa voting ward. And so these are all wards within Livingston District. So what this says is they're doing condom distribution within Dumbwa ward. They're also doing condom distribution within Kariba ward, condom distribution in Lubuyu ward, and if we scroll down, we can see they're also doing social and behaviour change activities within Dumbwa ward, and even HIV/AIDS, gender and human rights mainstreaming activities within the Dumbwa ward. So once we've collected this information for enough organisations, we can start to get an understanding about who is doing things within Livingston District, what they're doing and where they're doing it. And a good way to represent that is by doing organisation activity mapping. So if we click on that option, we get the map of Zambia. So if we're looking at condom distribution, which is a prevention activity, we can start to see graphically how many organisations are doing condom distribution within the different districts of Southern Province. And if we click on these different areas, we can actually see who is doing these activities. So we just looked at Network for Zambian People Living with HIV/AIDS, and we knew they were working within Livingston District, and so they're in this list. We can also see that about 8 other organisations are doing condom distribution within Livingston District. Whereas if we look at the Namwala ward, district, we're seeing 3 organisations. So if we want to drill down a bit further, and maybe this would be a nice way of representing for the PATF, we're now looking at condom distribution by ward, number of organisations doing that activity in that ward. So each of these smaller areas represent voting wards. So if we look at one of the wards of Livingston and we click, we can see that there's 5 different organisations doing the condom distribution within Lubuyu ward. What we can also see from this graph is there's a lot of organisations doing condom distribution within a relatively small area over here in Kazangula district. Whereas if we look at that compared to somewhere like Namwala, and we have a look at one of these outer wards away from Namwala town, you can see there's only one group that's doing condom distribution in that ward. If we drill one more level down, and this would be good for a DATIF level, we can see the number of organisations doing condom distribution within very small areas. And so if we click on this one, which is the Marumba ward, we can see there's 7 different organisations doing condom distribution. Whereas not far away, there's only one organisation, Society for Family Health, doing condom distribution within the Freedom ward. And so that raises questions. Why have we got 7 organisations doing condom distribution within such a small area when there's a need or possible need for higher number of organisations to operate not far away within the Freedom ward? And that's what the system gives you the ability to ask. So if we look at another example where we look at ART services, and we've split them by static and mobile. So if we look at static ART services within Zambia first. So immediately we can see that Livingstone has about 3 different organisations that are providing static ART services. Whereas, not far away in Choma, there's only one organisation that is doing static ART services. Now, if we drill a little bit further down and we look at Southern Province, we can start to understand maybe how far people have to travel for those services. So here's a pretty good example. If you look at Kazungula ward, which is Kazungula district, which is a very big area, we can see that there's services offered down here near the border of Botswana. Yet up near Kafui, there's no services offered in terms of antiretroviral treatment from a static centre. So what we're basically saying is if you live up here in this ward, we're expecting you to be serviced by mobile clinics. So if we change this and we have a look at the provision of ARTs from mobile centres, we can see that yes, in fact, this ward is actually serviced by the Kazungula District Medical Office using a mobile service. But if we have a look again at Choma, we can see that even with static and mobile services, there still appear to be a lot of wards that are underserviced in terms of ART services. What that means is either we're relying on people to travel a long way to access those services, or maybe it just isn't available to them, and that's why you might see lower adherence rates. So that's what the system gives you the ability to do, and thank you for listening.